Alright guys, it's Dr. Mohammed. We are back. This is Unit 3, all about delivering care, and in this video we're going to be talking about healthcare systems. So the American healthcare system itself is complicated, and we're certainly not going to demystify the whole thing in this video. Fortunately, the information that we need to know, it's not too heavy, but we're going to break it down. I made a lovely table for you guys to get this information across. Hopefully it's a little bit easier when test day comes around. So like I said, we're going to be talking about healthcare systems. The first thing that we're going to be talking about are medical insurance plans. And these are things that you may have heard of in medical school. You've probably heard of it on the news. You know some of these terms. We're going to break these down into all of the key features so that it's a little bit clearer. We're going to talk about each insurance plan. We're going to talk about how that insurance plan allows patients to choose a PCP, what they have to do with that insurance plan to see a specialist, and then some of the other important notes that go along with that plan. The first insurance plan that we're going to talk about is probably the one that most people have heard of, is going to be the Health Maintenance Organization, the HMO. This is a very common health insurance plan in the United States, and in terms of PCP choice, it is limited. There's a certain list of PCPs that you can see within your plan, within your network, and you can really only see them except for emergencies. So HMO plans, in terms of the PCP, you are limited to a certain list within your network except for emergencies. As we have seen throughout all of these public health sciences lectures, emergencies are always a bit of a special caveat. So limited PCP choice for HMO plans. Specialist care for HMO plans, you're going to need a PCP referral. So in this plan, you must designate a PCP, and through that PCP is how you will see your specialist, like the cardiologist or the gastroenterologist or whoever you need to see. The important thing to note about this is that the HMO plan is the most affordable of all the health insurance plans, and it's also the most common. About 42%, let's write it down here, about 42% of all Americans that have health insurance have an HMO. So it's nearly half. So this is a very common plan in the United States. The next health insurance plan that we're going to talk about is a bit of a step up, I guess we can think of, from the HMO, is going to be point of service. Now, point of service, in terms of your PCP choice, you can see providers out of your network. So that's a little bit different from HMO. HMO is limited to this list within network. Point of service plan, you can see providers out of your network. The caveat with that is you still need a PCP referral to see a specialist. So you still need to designate someone in your network, outside of your network, whichever it is, as your PCP, and that person will give you referrals. The caveat of that, the caveat of having this flexibility of choosing a PCP within or outside of your network, is that there's higher copays and there's higher deductibles for out of network, right? The insurance plans, ideally, they want you to stay within the network. If you're going out of the network, that's fine with a point of service plan, but you're going to pay more. So that's the important caveat to know with point of service. The next one, the third one that people have probably heard of, is the Preferred Provider Organization, or the PPO. This is also kind of a bit of a step up from the point of service, and it has the same thing here with PCP. You can see providers out of your network, right? So that's good. And the cool thing about this, now with the specialist referral, we don't need a referral from our PCP if we want to see a specialist, if we want to see that cardiologist. With an HMO plan or a point of service plan, we needed to designate a PCP, and we needed a referral from that PCP to see a specialist. With this Preferred Provider Organization, or this PPO plan, we do not need a referral to see a specialist. Same caveat as with the point of service. If you're going to do those things, if you're going to see someone out of network, if you're going to go to a specialist without a PCP referral, there will be a higher copays and higher deductibles for all services. If you want that flexibility to see people outside of your network, that freedom to go and see a specialist of your own accord, you are going to pay more for that. An important thing to note is that even though with a PPO plan, you don't need a referral to see a specialist, some specialists will still only see patients if they have a referral from their PCP. So even though you have that flexibility to see whoever you want, some specialists still want a referral from a PCP. Otherwise, millions of people could flock to specialists all the time, and they would get more overwhelmed than they already are. The next insurance plan that we're going to talk about is a little bit less common. It's an EPO. It's an exclusive provider organization. And the term itself tells you about the PCP choice. It is an exclusive provider, so you are limited in your PCP choice only to what is within your network. Of course, same caveat as with an HMO, except for emergencies. Let's kind of review things as we're going along here. A health maintenance organization, an HMO, you are limited in your PCP choice within network except for emergencies. An EPO, the exclusive provider organization, you are limited to your PCP who is within network except for emergencies. Similar to the PPO, similar to the preferred provider organization, with an exclusive provider organization, you do not need a referral to see a specialist. You can kind of think of this as I have written here. It's kind of a bit of a hybrid between an HMO and a PPO, limited in your scope of PCP to a certain network, but you can see specialists without a referral. Same caveats as before. There will be higher copays, there will be higher deductibles, and some specialists may turn you down unless you do have that referral from your PCP. So that is an exclusive provider organization. The fifth and final is even less common than the other ones, and that's an accountable care organization, an ACO. What is an ACO? In this one, PCPs and specialists voluntarily enroll to be a part of this. So there is still a certain list. The specialists, the PCPs will voluntarily enroll to be a part of this. And that way, the point of this accountable care organization is that patients are kind of getting all of the care within one network. There's no redundancies, no repeated imaging, blood tests, those kinds of things. It's all done within the same specialized list of PCPs and specialists who have enrolled in this. And the payments for this are through Medicare. The HMO, the point of service, the PPO, the exclusive provider organization, and the accountable care organization. Definitely want to know the caveats there in terms of PCP choice, specialist, who's going to be paying more, who's going to be paying less. Remember, HMO, the health maintenance organization, is the most affordable. The next thing we're going to be talking about here is Medicare. And I'm going to say that this one's high yield. This is something that's really important that we need to know. We hear about it in the news all the time. So what is Medicare? Medicare is a federal healthcare program for patients that are greater than 65 years old or less than 65 years old with certain disabilities. Those inclusion criteria are really important to know. So let's say it again. Medicare, federal. This is federal. This is the entire country. Federal healthcare program for patients who are 65 years or older or are less than 65 years but have certain disabilities. We don't need to get into the list of disabilities right now, but just know that you can qualify for Medicare if you are younger than 65 but have certain disabilities. The other important thing to know with Medicare is that there's 4 parts to Medicare, Part A through D. There's a really easy way to remember this, so we're going to go through it. Part A is going to be for hospital admissions, and this includes hospice. So hospital admissions is going to be Part A. Part B is going to be medical bills, and this includes any diagnostic tests, so any blood work, x-rays, CTs, MRIs. That is going to fall under Part B of Medicare. Part C, we can kind of think of as a combination of Parts A and B from private companies. Don't need to say too much more about that. And then Part D is going to be prescription drugs. The really easy way to remember this, hopefully this sticks for you guys, Part A through D, that first letter is going to tee us off here. So Part A is going to be for hospital admission. Part B is for bills, so A for admissions, B for bills. Part C is going to be a combination, and Part D is going to be drugs. So A for admissions, B for bills, C for combination of A and B, and then D for drugs. Really high yield that you know those 4 parts, know which is responsible for what. An example of a potential question that they may give an exam, they may say something like, a patient is admitted to the hospital, which part of Medicare does this fall under? And as we just discussed, this is an admission, A for admission, this would fall under Part A of Medicare. If a patient is prescribed a certain drug, what part of Medicare does that fall under? D for drug, it's going to fall under Part D of Medicare. So really, really high yield that you know those 4 different parts of Medicare. Finally, we're going to talk about Medicaid. We talked about Medicare, now we're going to talk about Medicaid. What is Medicaid? Medicaid is a federal and state healthcare program for people with limited income and or limited resources. Let's back up again. Medicare was a federal healthcare program. Medicaid is federal and state healthcare program. Medicaid, again, is for people with limited income and or resources. Another important fact that you may need to know, just in case they ask it on the exam, both Medicare and Medicaid originate from the Social Security Act. It's a little detail, but I just want to make sure you know it. Medicare and Medicaid originated from the Social Security Act. The other quick thing that I want to mention here, just so that we don't get it mixed up in our heads as to who qualifies for Medicare and who qualifies for Medicaid, fortunately, I have an easy way to remember this as well. Medicare ends with an E. So Medicare is for the elderly, E for elderly. Medicaid ends with a D. D for disadvantaged. So Medicaid is for the disadvantaged. Medicare for the elderly, Medicaid for the disadvantaged. Quick recap to make sure that we have all of this down. This is Unit 3, Delivering Care. In this one, we are talking about healthcare systems. The first thing that we talked about are medical insurance plans. Remember that the health maintenance organization, the HMO, is the most common. You are limited to who you can see as a PCP, and you need a referral from your PCP to see a specialist. This is the most common one in the US and is the most affordable. Point of service, you can see providers out of network. You still need a referral to see a specialist, a referral from your PCP. Of course, if you're seeing people out of network, there's going to be higher copays and higher deductibles. A PPO, a preferred provider organization, you can see providers out of network. You do not need a referral to see a specialist. Of course, because of that flexibility, there are higher copays and higher deductibles for all services. An exclusive provider organization, an EPO, you are limited in the amount of PCPs that you can see. It must be within your network. Remember, emergencies are an exception. You do not need a referral for a specialist, and this is something of a hybrid between an HMO and a PPO. And finally, an accountable care organization. PCPs and specialists voluntarily enroll in this, and payments are through Medicare. That being said, Medicare, remember, is a federal program. Qualifications are 65 years or older or less than 65 with certain disabilities. Remember, Medicare ends with an E, so it's for the elderly. There's 4 parts. Part A for admissions, Part B for hospital bills, Part C for combination of A and B, and then Part D for drugs. Medicaid is a federal and state healthcare program for people with limited income and or resources. Medicaid ends with a D for disadvantage. That is the end of this video, and I will see you in the next one.